You are listening to the Partner Up podcast by Welcome to Bundaberg. I'm Gayle Reynolds, and in this series you will hear from community leaders who are kicking big collaborative working together goals. We will highlight the successful partnerships, shedding light on the positive impact they have had on both businesses and the community. Welcome to Bundaberg aims to improve the health and well-being, work and lifestyle outcomes for people living in Bundaberg by activating and implementing a range of community-led strategies across a range of services for a more connected, cohesive community. Let's go. Before we start today's episode, I would like to acknowledge country. I would like us to take a moment to reflect on the meaning of place and connection. In the spirit of reconciliation, I wish to acknowledge the traditional custodians of the lands on which we live, work and love on. I pay my respects to elders past, present and emerging of all the lands, and I extend that respect to all First Nations peoples listening today. Hello, thanks for joining us for Episode 2, Community Centred Solutions Series. I'm Angela Twyford, and today I've taken over the seat standing in for Gayle because we will be chatting with Gayle about the project. And if you haven't already listened to Episode 1 with Corrie McColl from the Neighbourhood Centre, go back and listen to that one now, and we're going to get underway with Episode 2. Thanks for joining us, Gayle. So how'd you come up with the project idea and strategy? Well, I think we need to take a few steps back when we look at project strategy and remember that the approach that we take when we do anything is we look at the whole community, and we like to empower the community to take ownership and responsibility of what they're doing, where they're going, what they want. So when we looked at the outcomes of the project that Corrie was trying to achieve, we really needed to think about the social impact that was going to happen and how were we going to achieve that and how were we going to measure that. So we implemented first and foremost a quality outcomes framework and worked backwards into what we were trying to achieve. And what I did was really just looked at this project as part of what I would do if I was writing a research paper. So it's about gathering all the primary data that's already existing in our community, looking at what had already been tried and tested and done. So we collaborated with a number of organisations and networks and government agencies to look at the data. So we gathered that primary data first, and then we went out and collected secondary research because we knew that we needed to know where we were starting from. And we really wanted, I guess, validation that that data that was previously collected here in Bundaberg was still existing. So then we did an analysis of the primary research and the secondary data that we'd created, and re-evaluated what the project needed to be and what it needed to achieve. And we always kept coming back to what was the primary focus and the outcomes that Corrie wanted this project to achieve. And so what was the theory of change that needed to happen? Where are we now and where do we need to be? And does those outcomes still align? And the most important thing that we did right at the beginning was we had a really good understanding after doing this analysis of where the community is at. So meeting the community where they're at and really implementing a theory of change that needed to happen to get to the outcomes that Corrie was trying to achieve. So for us, every project that we do is always from a participatory concept. So we really want to empower the community to take ownership of and responsibility of whatever's happening, the growth, the development, the engagement. And I think it was a really smart choice on Corrie's part to partner with Wide Bay Kids and Welcome to Bundaberg and you and I on this project, because essentially it takes a really long time to build trust and meaningful connection and relationships in any community. And I find it particularly hard or harder in regional and rural communities. And so we have already a well-established network of people around us that we could go to and work together with to ensure that we could hit the ground running, because this project had a really tight time frame. From start to finish is less than 6 months, and what you were trying to achieve with the outcomes, you needed to make sure that you worked with someone who was well established and could go right from the beginning and implement the outcomes that were needed, or implement the strategy to achieve the outcomes that are needed. Okay, so we'll have a look at the data that's already been collected so far with this project. So the primary research and any secondary research that we've mapped out. One of the outcomes for this project was to map out existing service gaps and identify areas where waitlists exist. A second priority for this project was to build out an ecosystem of providers here in Bundaberg, and also identifying those relevant support services and agencies in the Bundaberg region who can collectively help provide a more timely and appropriate support for people in need. So let's look at that now. When we were developing this project with Corrie, we initially looked at a 5-phase approach. So the first stages were to explore, gather the data, identify the gaps, do the sector mapping, and look at any existing allied health services availability and map out what their wait lists look like. And we continue to do that. So as the project has developed and grown, we've mapped out quite a number of these services so far. So moving into phase 2, which is discover. So actually then engaging stakeholders in those community conversations to identify what the barriers to recruiting and retaining staff here in Bundaberg are. And then moving into design, which is phase 3. So bringing all those people together by hosting strategic conversations, using evidence collected to develop a working together framework. And so that's really the position we're in right now. We're just about to host our community conversation, and we've explored, we've discovered, and now we're moving into that design phase. And the hope is that once that happens, we'll move into phase 4, which is change. So supporting any positive change movements that come out of that community conversation and the work that's already been done to support and implement any actions of collaborative ethics for a pilot, or any test approaches or methods that come out of that community conversation. So we're going into this with no set agenda. It's really coming from a perspective of where the community's at now and what their needs are. And then we move into phase 5, which is a reflection to review, reflect on the project, identify any recommendations and improvements using the quality outcomes framework that we implemented at the start of the project. And then phase 6 was an extra phase that we added on not too long ago. So it wasn't originally in the first 5 phases of this project, but we worked out along the way that we really wanted to implement phase 6, which was practice, and that was to help the community continue to work together and actively participate in a best practice approach. And that was a really important addition to this project. The data that we have gathered so far is around identifying the gaps in the sector and mapping out existing allied health services available and their wait lists here in the Bundaberg region. So we know that 25 to 54-year-olds is the highest workforce within Bundaberg, and we currently have a very low unemployment rate of 5.3%. Allied health workforce data tells us 730 additional workers within the region since 2013. So quite an increase, but considering our growth in population and programs like NDIS, still not enough within our region. We know that regional Queensland jobs data tells us 17% of Queensland workers will work within the healthcare and social assistance sector within the next I think by 2025, the data tells us. So a really big percentage of workers within Queensland. The next highest data is 11%, which is in retail. So we also looked at data from Dr. Kath Cosgrove and the work she's doing in attracting and retaining allied health or health professionals in general in rural and remote communities, and the work that she's doing on adjusting to change and the workforce challenges considering career and life stages people go through. And it's a really interesting set of data stats that's being collected there, and one we'll go into in more detail at our community conversation. So far, we've collected 144 allied health professionals currently within our ecosystem mapping, and we're still continuing to collect those. And we're still also collecting what the waitlist situation looks like within the Bundaberg region as well. And so all of this data has been collected through face-to-face conversations, through an online survey that we currently still have open, and also Bundaberg Regional Council, Queensland Government Statistics Office, the ABS, PHN, regional jobs data, and anticipating future skills data as well. So when we're having conversations with people, there's three main things that people are telling us that are the biggest challenges with helping to reduce wait lists in Bundaberg for allied health professionals. And those things are attraction. So attraction of tertiary qualified workforce within our region. So the pool of locally qualified workforce is low. Attracting qualified candidates to the region is expensive and competitive, and there's a lack of shared resources and collaboration within and across private and public sector. The second, which is no surprise, is housing. So it's a very competitive housing market. Lack of rental properties available increases pressure for attracting new people to our region, and homelessness is at an all-time high and increasing. So a really big struggle for anyone bringing people to our region. Retention, losing workers to other agencies or into private practice is a high risk. So when you are trying to hold on to people, we've got that extra layer of difficulties when trying to retain them. And it's a big risk. It's expensive to bring people here. It's a big expense to hold on to people, but it's an even bigger expense when people leave and go to our competitor or perhaps start a new organisation on their own. So social connection for a whole family is time consuming and difficult. So we know that when people move to a new region, social connection is a really big part of embedding them into our community. So we need to make sure that there's time spent on this. And lack of unique value proposition and positive workforce culture within our organisations is lacking as well. So they're the top three things: attraction, housing and retention. So now we are in our discovery phase of our project. So we're looking at, we're still in that phase 2, moving into phase 3 of our project. And discovery is all about having those conversations, talking to people, building connections and trusting relationships across the sector, private and public, creating a more welcoming community culture. It's about collaboration between organisations, agencies and businesses and the public to bring people together, to share ideas, to come up with solutions. And that's when we move into the next phase where we have our community consultation, and together we can come up with a model and adapt it to our specific sector needs. And then community, it's about continued support to support the needs across the sector with a leadership group or a peer group or continuous improvement events. And what that looks like will depend on the conversations that happen during our community conversations, and then when we look at all of that information as a whole, what the next stages and are of this project. So that was a really good outline of the strategy, so thank you. I know how much work you've put into this, and I'm really looking forward to hearing how this all turns out, at our community conversation happening in May. Yes, so the next stage for us now is, as we move into the community consultation, is to bring together all of those people who have been involved in the project previously up until now, and also invite other people, because we are still in that phase of, where are people in our community at, and how can we better work together? And to do that, we need to bring people together. So looking forward to that day and to finding out and learning more about what's happening on this topic in the community. And then from there, we will, look at all of that information that we gather, compare it to what we've gathered previously, and then host something else towards the end of June, where we can hopefully have some more sustainable and long-term outcomes for our community within this space.
Yeah. Great. Thanks very much.
Thank you for sticking around to the end of this episode. If you would like to listen to future episodes, you can follow or subscribe to Welcome to Bundaberg on YouTube, Spotify, Apple, and on our socials, Facebook, Instagram, and TikTok at Welcome to Bundaberg.